Hi everyone, and welcome back to our YouTube channel for your childcare or health and social care course. We're going to try and use these videos for both courses, so that will really help us out from our side and it will help you out on your side there as well. Okay, so if we have a look at Unit 7 today, what I'd like you to do is to get your work booklet out, and I'd like you to go to, it's page 79. Okay, so we're quite lucky because this unit is quite short, so it is quite important that we obviously get this unit done as quick as we can. Because it's one of those shorter ones, it shouldn't be too difficult for you to do remotely at home, so fingers crossed we should be able to work through that together now. Okay, so on page 81 there, you can see question 48. So question 48 says define person-centered support. Okay, so when we're thinking about person-centered support, we can think of it in terms of children, we can think of it in terms of adults, we can think of it in terms of teenagers. It doesn't really matter who you think of it as, because person-centered support is all about that person, regardless of their age group. Okay, so previously when we've talked about things like equality and inclusion and diversity, we've talked about respecting those differences that people have and making sure that people have an equal opportunity in life, no matter what that could mean for that individual. Okay, so person-centered support is making sure that we are taking into account that person's needs, so what they need to live, be that air to breathe, perhaps they need oxygen, be that food to eat. We also need to take into account their wishes, their likes, things that they wish for in life, things that they want to happen in their life. And we need to take into account their dislikes as well. So we don't want to force somebody to do something that they're not comfortable with. So for example, you could be working with, in a school environment, in a nursery environment, or perhaps, well, any age group really. You could be working with people with learning disabilities, you could be working in a care home for the elderly, and there might be some sort of sports event, perhaps something to sort of coincide with maybe the Olympics or something. And not everybody is sporty. I certainly wasn't sporty at school. I did my bit, I tried, but I never won any awards for it. Whereas some people would absolutely thrive in that environment and they would really, really enjoy taking part in those sports. So that might be someone's wish, but it wouldn't be mine, it would be my dislike. Although I'd like to watch. And that's the difference, isn't it? So in order to support me to take part in that activity, you would need to provide me with somewhere to sit and watch and observe. Maybe join in with something if I want to. Okay, so person-centered support, like we say, it's about making sure we are taking into account their needs, wishes, likes and dislikes. This also helps a person to feel safe and secure, both physically and emotionally. So if somebody feels secure in where they're living, if they're quite happy where they're living, be that in a care environment, if they're quite happy to go into that school, into that nursery, then they're going to feel safe emotionally. Okay. Person-centered support also allows people to achieve their goals and aspirations in life. So it shouldn't really matter what gets in the way. So if I take, for example, when I worked with a young lady with a learning disability, she really, really wanted to learn how to dance. But she had a learning disability and she was she struggled with balance, so she had some sort of physical disability there as well. But to enable her to be able to dance, because that's what she wanted, that was one of her wishes, we ensured that she went to a dance school that was appropriate for her age group, because we didn't want to put her into, your average sort of beginners class where perhaps the average age is a lot lower than hers. We also made sure that she was supported by somebody whilst doing the moves. She was a little bit closer to the mirrors so she could see what she was doing, which enabled her to see, because she had a slight visual impairment as well. And all of those things took into account her as a person, rather than just taking into account, oh, she wants to learn to dance, let's put a YouTube video on. Person-centred support also includes involving the family, the friends, the carers in the care plans. So family will know their child best, or the carers will know the child best. And it's the same when we think about adult care as well. Those people that have been around that person for, a very long period of time in their life, they will know that person a lot more than sort of any of us do when we're first meeting that person. So it enables you to find out those needs, those wishes, those likes, those dislikes a little bit more, especially if the person is unable to communicate that themselves. Person-centred support, lastly, it respects the cultural differences and beliefs that people may have. So if we were expecting everybody in a care home or everybody in a school to go to church, that's not respecting the different cultures and beliefs that people may have. We can't just treat everybody exactly the same. We've talked about this a little bit before, and we've called it institutional abuse. And that is exactly what we're trying to avoid with person-centred support. So to answer your question, if you can tell me a little bit about each section that we've covered there. So giving support that takes into the account of the person or child's likes, dislikes, their needs, their wishes, respecting culture, respecting their beliefs, involving the family and friends and carers in their care plans, allowing people to achieve their goals and aspirations, and allowing people to feel safe and secure, both physically and emotionally. Okay, so just pause this video for a moment whilst you finish question 48, and then resume when you're ready. So your next question, question 49, says outline the importance of finding out an individual's history, needs, likes and dislikes. And wishes. I missed that bit out. So we've talked a lot about needs, wishes, likes and dislikes, and it feels like it's quite repetitive, but it is just so important. It is your key component in providing care that is person-centred and that is not going to discriminate somebody. So what we'd normally do at this point is get you to answer some questions in the classroom. So I want you to think about those questions while you're at home. So think about, what time do you like to go to bed? Do you eat breakfast in the morning? Do you have a big meal at lunch or a big meal at tea time? Do you drink fizzy drinks, or do you drink hot drinks, or do you prefer squash and cold drinks that are flat? What's your favourite colour? What's your favourite activity? Do you have any hobbies? What's your favourite food? Okay, so in answering some of those questions, or at least thinking about those questions, what you've done is you've thought about your wishes, your likes and your dislikes. So if we did this in the classroom setting, the likelihood is that we'd all have relatively different bedtimes. So generally speaking, some people will go to bed at midnight out of their preference, and some people like to be in bed by sort of 9:30, 10 o'clock, perhaps with a book just to wind down. Some people prefer to have a big meal at lunchtime so they're not feeling a heavy stomach at tea time. And then of course we have our favourite things like, what do we like to drink? When I worked in a care home previously, there was a lady and she was given a cup of coffee, and when her relative came to see her, they said, well, of course she's not going to drink that, it's coffee, she drinks tea, she's always drank tea. And it's just those basic things where if we are treating people in a way that they don't want, be it through personal care or be it through giving them a drink that they dislike, then we're not being fair to their needs and we're not providing person-centred support. So if we go back to your question there for question 49, it says outline the importance of finding out all of these things. So the importance of finding out that personal history, the importance of finding out their needs, their wishes, their likes, their dislikes, is so that you can match the support that you're giving to the person's wishes which helps you with inclusion. So it helps everybody to feel included and welcome and equal in the care that they are given. It also helps people to feel supported, and it helps people to feel that their differences don't matter, so they feel respected. And I hope that you can see that. So if you think about it yourself for a moment there, if you were in a care home, any of you at your own age could end up, in a hospital bed, in a care home. I'm not wishing that upon anybody, but it can happen. I've helped and nursed people who are in their mid-30s who are living in care. So it can happen to anybody. But if you've already lost that sense of yourself, that ability to live at home, if you've lost everything around you, if you've lost those people around you that have always been around you, perhaps you live with your partner and your children, but you don't anymore because you're in a care home, and it's just not a nice feeling. So those small things that we speak about, if you prefer to wash your hair in the morning compared to at night, if you prefer to have breakfast at 10 rather than at 7, if you put yourself in that situation and you're in a care home and you're told to, people come in and help you to get up and get dressed at 7 o'clock in the morning, to have breakfast before 8 and medication at 8:30, and then lunch at 12 and dinner at 5, and then before you know it, you're back in bed for 7. That's not a routine that I'd want in my mid-30s, my mid-40s, my mid-50s, perhaps even above that. I don't know, because obviously I'm not there yet, but it's certainly not something that I'd be wanting, and it's certainly not something I hope you promote. It is difficult in care to sometimes step away from this model, because some care homes are set up in this very regimented way, and the reason for that is it works for the staff. It's easier for the staff, and it can be very difficult in your first sort of job in care to change things, but it is important that you are listening to those service users. Okay, so once we've finished 49, I want you to turn that page over and go to question 50. So question 50 is on page 82. If you're still writing on 81, please pause this video. Okay, so question 50 on page 82 says, give at least 3 examples of how to provide person-centered support when supporting individuals in day-to-day activities. Okay, so we've got some scenarios here that we'd normally go through in class. So the first one is about eating food. So in that first day-to-day activity, in the first box there, you can write eating food. A child with a learning disability has difficulty eating food as she pushes the spoon too far down her throat. Staff at the nursery are worried that she will hurt herself and have asked her parents for a review at the doctors because they do not feel comfortable. What equipment could make it easier for the child to eat without pushing the spoon too far down her throat? So what you can get are some spoons that are sort of bent, so they're on a bit of an angle. Okay, now the idea of that is that you cannot get it down your mouth any further because there is a bit sticking out, so at the point where it bends, you're not going to be able to get it any further. So this is person-centered support because it promotes independence for that child. So rather than making the child be fed by a key worker at the nursery, you are allowing that child to feed themselves. So it promotes independence. It stops them being dependent on staff, which in turn stops institutional abuse, and it allows the child to continue with their education. So if it was seen to be a very, very difficult thing to manage in the nursery, perhaps the nursery might say we cannot cater for their needs because of our ratios. So what I want you to think about writing next is how to provide the person-centered support. So you can start it with, if a child is using a spoon to eat and they're damaging themselves and putting themselves at risk by choking or pushing the spoon too far, we could use an angled spoon because it limits the movements. Okay. Scenario number 2. A 13-year-old girl in a residential care home for teenagers has moderate to severe hearing loss as a result of abuse as a child. He uses hearing aids but is refusing to wear them because he says they're not cool and people make comments about them which he dislikes. However, without the hearing aids, he cannot understand what you are trying to say to him. So how could you help him to communicate with you? But just remember, he has the right to refuse the care, which can include refusing to wear his hearing aids. So on your day-to-day activities, on number 2, you can put communicating. So what we're going to do this time is a little bit different. So rather than sort of giving him another aid to help him, we're going to find out from him himself what is his preferred method of communication. So if we think back to those last 2 units that we've done, we looked at this in terms of communicating to find out their preferred method of communication. And we looked at it in terms of equality and inclusion, because this person can be treated with an equal opportunity if we allow them to have their voice heard with person-centered care. So because you need to find out the preferred method of communication, there is a way you can do this. You could ask him to write it down. You could write a question and he could write an answer. How would you prefer to communicate with me? You could try some picture cards. You could try Makaton. I asked you to have a look at Makaton previously. Try and get him to open up that way, but he may refuse. So asking him his preferred method of communication is a simple way to support this individual who is no longer wishing to wear his hearing aids. So in the box that says how to provide person-centered support on communication, you can say if a young adult needs but is refusing to use a hearing aid because they are self-conscious of them, they could use concealed hearing aids, or we could find out a different method of communication for them, such as writing or Makaton. The next scenario says working to people's strengths. So you are working as a support worker for a young adult with a learning disability. He says that he wants to go food shopping on his own as he's allowed to get on the bus on his own to college, but you're unsure whether it is the right thing for him or not, as it is a new suggestion. So this is quite a common thing, okay? When you are working with somebody with a learning difficulty, they are, a lot of the time when they're in college age 16 to 24, they undergo something called travel training, where they learn different bus routes and they do exercises on those buses, so they get on the buses. They learn what to say to the driver. They learn how to either swipe the card on it or pay for that journey. And it's quite a lot of responsibility for somebody with a learning difficulty to undertake quite often. So the scenario here says about he's allowed to get on the bus on his own to go to college. So he's obviously been doing some travel training, but he now wants to go food shopping on his own. So is he allowed or not? So on the left-hand column, you can write working to people's strengths. Working to people's strengths. So because he's gone on the bus on his own for a while now, you need to work to his strengths. He's got some skills of independence from the bus trip, but you need to make sure that he is safe in the supermarket, because that is going to be part of your duty of care. Okay, so because he was obviously travel trained to learn how to use the bus, which is a great thing for him, how about, maybe trying to bring something in like shopping training? This wouldn't be a decision that you would make first and foremost. You would have to obviously bypass this to managers. It's just a scenario to help you to understand how people can be supported individually based on their own personal needs. So you could try perhaps some shopping training where you could assist him from a distance that gets larger each week in case he needs help, and then finish that training by perhaps waiting in the cafe for him, so that you're on site, you're available, but he's still got that independence. So by doing this, it'll promote independence and work on his skill set, which will prevent any institutional abuse. Okay, so in that box, how to provide person-centered support. So you could say, if a person with a learning difficulty wished to go shopping on their own and they were able to get on the bus on their own, we could speak to our manager about starting up some shopping training, which will help him to stay independent and stop institutional abuse. So I do have a fourth one here as well. You've only got 3 boxes there, but those of you that are doing the adult care course, you may want to listen to this one as well. It will still benefit you if you're doing childcare, of course. So the last one here, how to address people. So if you wish to do this one instead, you can put addressing people on the left hand box. We've got an 85-year-old lady who's come into the nursing home after having a fall and breaking her hip at home. She's not happy about being in care, and she's even more unhappy that people keep calling her Sylvia. She communicates with you, but every time you say her name, she replies, "That's not my name, dear." You check her care plan and that's what it says. What would you do? So how to provide person-centered support. You should always use the person's preferred name. If it's not clear what their name is in the care plan, ask them. If Sylvia's preferred name is Doris, then call her Doris. Nice and simple, that one, but such a great way to provide person-centered care, because I wouldn't want to be called something that I'm not known by at all. You know, if someone came up to me and said, "Miss Wilmore," I'd be like, "Oh, well, it's very, very sort of posh for me. Just use my first name. That'll be fine." Okay, so I'll let you finish question 50 on page 82. If you are still writing, please pause this video. Okay, so on to page 83. Page 83, question 51. Outline the benefits to an individual of person-centered support. Remember to use sentences in your answer. So the benefits of person-centered support, I feel like we've talked about this so much already. It's a little bit repetitive. However, like I say, it is the key part of working in any care environment, be that care environment in childcare, in schools, in youth work, with young people with learning difficulties, or in, you know, hospital care or elderly care. People want to be treated for who they are, not for being a patient, a service user, a child in school, a student. So the benefits of person-centered support, it allows people to express their individuality, okay? So they can tell you what they like. They can tell you what food they like, what music they like to listen to, whether they like a bath or if they prefer a shower, what their routine was at home, what TV they like to watch, do they like podcasts, are they into social media? It gives people good well-being, so they feel more emotionally stable. If somebody is accepting you for who you are, then you automatically feel much more welcomed in that environment. If you were to enter our classrooms and we treated you all exactly the same, you would not feel very well sort of addressed, and you would feel perhaps that it wasn't for you. But we always try and make people feel welcome in their own ways. Empowerment. So empowerment means that somebody is in control of their care and that they can tell staff if they wish to change something. So person-centered support allows people to tell the staff members that they're not happy with something that's going on. Perhaps they don't want a particular carer coming in anymore. If it's for a genuine reason, then that's great. It could be that they no longer want to take a bath in the morning because their hair stays too damp all day and they want to take a shower at night and have the hair blow dried. Maybe they want to go to the hairdressers twice a week because the perm isn't setting as well as it used to, rather than just once a week. These are all things that can be changed, and if you are approachable in your way that you are providing care, then it will be well received. Think of it in terms of like toys for children as well. You know, if If children want to play a different game, but they feel that they're being forced to play a particular game with you, they perhaps won't want to voice their actions or voice the way that they feel. And then that becomes a tricky situation, because if they're not only feeling that they can't speak to you about, oh, I want to play a different game, what else are they going to withhold from you? It lets people have involvement in their care planning and inclusion in the setting. So if you're struggling to sort of get started on that, I've got an example here for you. So if a person is given person-centered care, it will help them to feel empowered by giving them freedom of choice in their care plans and feel acknowledged if their likes and needs are met. This promotes their well-being and a sense of individuality. You could also start it with, if a person is given person-centered care, they are able to tell you what their likes and dislikes are, such as food and TV programs. They will feel that they can change the care that they're receiving and talk to you about their problems. They will feel included in a setting, which will make them feel more positive and emotionally stable. Okay. So I'm going to move on to 52 now, so if you're still writing, please pause. Give at least 3 examples of how individuals can be in control of their care needs. So we've got some examples here, okay? So to be involved in their care plans, they could tell the staff what they like, what music they like, what foods they like, what routines they have. This is for children and adults. Obviously, people have different likes and dislikes all throughout life. So music, foods, routines. Telling staff how often they like to have a bath or shower or wash their hair. And if you compare that to sort of children's care, perhaps how often they are required to use a moisturiser if they have eczema or something. Telling staff what their hobbies and interests are. Telling staff what makes them upset or annoyed. The next part is being involved in decision making. So if we think about this in terms of sort of children perhaps in foster care, rather than like a nursery setting, and then adults all the way through sort of the care system there, teenagers in sort of foster care or care homes, they are able to choose where they live. This is to a certain extent, obviously, because their dream home might be a mansion, and isn't it all for us all? But in terms of sort of foster care or nursing homes, residential care homes, supported living environments, they should be able to live within the vicinity of their school, of their family, of their friends, in that local area that they're used to living in. Being able to choose who their key worker is, so being able to choose their closest carer. So rather than being allocated somebody to work with them, actually being able to choose who that person is, who will be able to sort of amend their care plan for them and listen to them, and work with them in their care. Being able to choose who can visit them. So not everybody wants visits by absolutely everybody, do they? We all have sort of family rifts and things, and we might have somebody in the family or a friend that we are no longer sort of having that relationship with, and it is down to that person to make that decision. Just because they're in a care situation, it doesn't mean that they have to give their consent to see that person. Being able to have the right to consent or decline treatment, like operations or medications. Okay. So this in particular sense of sort of adult care. In terms of children's care, especially if children are looked after by the local authority, it could be that decisions are made sort of above them by parents or by the local authority themselves. Okay, so lots of examples there. I'd like you to give me at least 3 of those. So you've got 3 boxes to fill in with example 1, 2 and 3 on page 83 for question 52. So you can make a start on that now, and you can rewind a bit if you want to re-listen to those. And that brings us on to our last question. So on page 84, question 53, we have Outline how assessing risk can assist person-centered support. Remember to use sentences in your answer. Okay. So when we are looking at this question, it says outline how assessing risk can assist person-centered support. And it's funny how it's written. Now, I'll just break it down for you if you're unsure. Some of you might understand, so just bear with me a moment. So assessing risk can assist person-centered support. And the reason for this is because the person should always be at the centre of their care plan, of the planning of their care. So if it is assumed that somebody with a spinal cord injury cannot get themselves dressed because that's normal for somebody with a broken spine because they are paralysed, it doesn't mean it's the same for everybody, okay? And it's down to care staff and managers to assess the risk and see actually how much independence can this person have. Okay, so that's just one example of it. The person themselves are the best judge to say whether they feel safe or unsafe. What you have to do when you're working in care is to find out the balance between the risk and the benefit. So if we go back to that example that I gave you before of shopping independently, we've got to think of a few questions when we're thinking about that. So is this person going to be safe when they're shopping? Will they learn some independent skills by going shopping? And is it their choice? So if a person was going to the supermarket and they'd never been to the supermarket on their own before, but they knew which bus to get, getting a bus and going into a supermarket are two very different things. Going into a supermarket, especially sort of a quite large one, it could be very sort of overwhelming with the bright lights and the lots of different colours and smells and people and voices and music going on. There's a lot of sensory things going on there. So if you send somebody with a learning disability such as autism to a shop on their own because they can get the bus on their own, then you're probably thinking now, oh, I wouldn't do that. And that's where we need to get the balance between those two decisions. So total independence versus supporting them to gain some independent skills. And that's where we talk about that balance of the risk assessment. So assessing risks and managing these risks can help an individual to maintain or gain independence in life. It keeps themselves and others safe, and it prevents any further harm to the service user's health, so it'll give them a sense of security and it'll help people to trust the care providers. Okay. Another example of that, if you're struggling to understand it, is let's say, for example, you're working with an elderly gentleman who wanted to go fishing, okay, but he's very, very unsteady on his feet and he uses a Zimmer frame. What you've got to do is think, right, so we can't go to somewhere that is particularly sort of muddy or has quite deep grass verges and things, because the likelihood is it's going to be too risky for his mobility, which is limited, and he's going to slip. So how can we let him go fishing? Because if we say, no, you can't go fishing, you can't walk anymore, that's institutional abuse. Whereas if we can find a way around that, so perhaps we need to do some research of the local area, perhaps we need to look at sort of private ponds where there might be a path that goes all the way to the edge of the water. Perhaps there's a family member who could take him. There's lots of different things that we need to think about rather than just saying no. And this is where assessing the risk, yes, the risk may be too high at one place, but it doesn't mean it's going to be high at every place. Okay. Those of you that are doing childcare, you can think of this in terms of toys, because a lot of toys say, don't use this toy for under threes and under. And it's the same thing. A risk assessment has been done to make sure children 3 and under or under 3 do not swallow that toy. So if they're playing with it, they put it in their mouths, they could choke. If we are allowing a child who is 4, who still puts a lot of things in their mouth, be it due to a learning disability or be it due to a development delay or just something that they do as part of who they are, they've not really grown out of that, then you're still going to have to assess the risk of giving them small toys. Small pieces of Lego could still get lodged. So it's about assessing that risk. Yes, they want to play with that Lego, but they're going to choke. So how are we going to manage that situation? Is it too risky to let them play with it? Can they play with it one-to-one? Can they play with it in a group situation? And it's going to be down to the individual. So it's, again, person-centered support. Okay, so that should make sense, hopefully, fingers crossed. And that should finish your question 53 on page 84. If you've got any questions or queries, please don't hesitate to contact me. I'm available on email and my phone as well, Tuesday, Wednesday, Thursday. And if you're part of Jackie or Jill's group, likewise, you can contact them. Thanks for watching.